Welcome to InnoHEALTH magazine podcast. I am Anjali, your host, and here I am with a very special guest, Colonel Binu Sharma. She is a Senior Director of Nursing at Max Healthcare. So, very warm welcome, ma'am. Ma'am, firstly, I want to say I'm very privileged to share this space with you. So, how are you, ma'am?
Thank you so much, Anjali. I'm equally happy to share this space with you for InnoHEALTH magazine.
Right.
It's such a beautiful morning and just the next day of the very, very special Republic Day,
Right.
where India finished 75
Of the
years
Republic.
So a very special day for me too.
Yes,
Thank
ma'am.
you.
Yes, ma'am. So, ma'am, can you please tell us about yourself, your journey, like very important moments in your career? Because somewhere I heard that you were a topper in mathematics.
I was.
But then you shifted to healthcare. So how
See-
was it easy or difficult? So how was your journey in overall?
See, it's been a very, very unique experience. I was born in a village in Delhi, Mahipalpur. I do not even know if you're aware of the village. And at that point of time, I'm talking more than 60 years back, there were hardly any schools. We just had a primary education in that village. And I think right from childhood, I was very different. I was very vocal. I was very ambitious. And I think I was a kid, 4 or 5 years. My grandparents used to say, I said, I want to be the Pradhan Mantri at some point in life. So a village girl at 5 years talking about to be a prime minister,
Right.
itself, that means she has big dreams.
Right, right.
I was shaping up well in my studies, and I chose science for my higher education in school.
Okay.
And I did very well. In fact, I got distinction almost in all the 5 subjects in my 11th standard.
Okay.
Mathematics and science were my favorite subjects. I wasn't very sure, but I wanted to be a doctor. And I started getting ready with my pre-medical exams to be a doctor. Those days we had a different method of joining the medical. I didn't make it to the medical field in my first attempt.
Okay.
Hence, my next passion was mathematics, where I used to get 100 on 100. So I joined Venkateshwara College in Delhi University as a statistics honors student.
Okay.
And I was doing very well. We were only 10 and I was topping the batch. But destiny has something else for us.
Right.
Although my mind was on mathematics, my heart and soul did not belong there. I was very restless inside.
Right.
I wanted to do something else. I'm a people's person by personality. And I think I did not choose nursing, but nursing chose me.
Right, right.
I spotted an ad for military nursing services, and the next I know I appeared for exams, interview, and I joined the Indian Navy as a cadet nursing officer in 1977 at Mumbai. So that's how my journey started. It was very difficult to step out of the village to be part of the Indian Navy. Not thinkable at all. There was resistance from my home, my relatives, the villagers. A village Brahmin girl going all the way to Mumbai.
Right.
I was told, come back if you don't like it there. My dad told me that. And he was a strong believer to give freedom to all his kids. And I never looked back. From 1977 to now, in 2025, I'm very glad that I chose this profession. I'm very, very proud to be a nurse with more than 45 years into nursing. Every single year has been a year of challenges, has been a year of learning, unique experience.
Right.
Nursing profession is so unique.
Right, right.
And I always say to the young nurses, it's a unique combination of the art and science. Art is the passion, the kindness, the empathy you bring, the human touch you bring. And the science is the knowledge, the competencies. and you combine these together to develop a great attitude and to be very, very sacrificing, giving, caring nurse in this profession.
Right.
So that's how my journey has been, from a student from the Navy to a young nursing officer, moving into critical care nursing, developing as a manager, taking leadership roles, and here I am with Max Healthcare into a leadership role.
Ma'am, we are very proud of you, and I think you are very inspiring, and your thoughts are also very inspiring. Maybe many young nurses will look up to you. So, ma'am, what are the important qualities of a good nursing worker or professional so they can develop in early years?
A nurse needs to develop n number of qualities. Nursing is unlike various other professions.
Right.
Here you are the critical thinker, you are the decision maker. You need to have the knowledge, you need to have the right skills, you need to have the specialized knowledge and skills. You need to understand the equipments with what you're working with, the technology in today's time. You need to understand the diagnosis of the patient with whom you're working. So to be a good nurse, I would start with that. To be a good clinical nurse, you need to have the knowledge, you need to have the right skills and the competencies. About this, you need to have the right attitude and aptitude to learn every single day.
Right.
As a nurse, situation changes every day. One day you see a patient coming with a gunshot wound and you are taking care of that patient in the emergency room. The next moment you see a lady coming in active stage of labor, just about to have her newborn or her delivery. The third moment you see a patient with acute heart attack. Life keeps on changing every few minutes or every few hours. Hence, for a nurse to have the right attitude, to have the aptitude to learn, to develop herself, to have immense amount of patience, empathy, tolerance, physical endurance. You need to be physically fit.
Right,
you need to be mentally sound. You need to feel and showcase you are stress free. You need to be communicative to talk to the patient's family, to the other caregivers, your partners. So the number of qualities you need to be a good nurse, I think, are endless. I can go on and on. You can do a podcast only on the topic of what qualities a nurse needs.
Sure.
She's a very special person, a very unique person. So she needs all of these qualities where she can sacrifice her happiness, her time for a patient and for the society and for the good cause of community.
Right, agree, ma'am. So, ma'am, like nursing is a very demanding, profession. So, how can nurses, how can they cope with the emotional demands with their professional responsibilities?
You see, it's, as I said, it's very tough to be a nurse. A nurse, when she graduates from the college after her undergrad, she's just about 21 years old. She's very young. And in nursing, you find 70-75% people are women.
Right.
They are young. They haven't seen the world much. The moment they graduate as a nurse, they're expected to take on the entire stress, burden, and the load of managing a patient.
Right.
Whether the patient is in a critical care setting, in an operating room, whether the patient is in a labor room, whether the patient is in the emergency area of the hospital or in a ward. So a nurse is expected to understand, work according to the disease of the patient, according to the management recommended by the doctor, applying her critical thinking, applying her decision making. And as I said, there are so many things she's expected to do. She's expected to monitor the patient, document the condition, take the clinical escalations, act where she is required. In times of crashes where a patient is deteriorating, she's supposed to inform, escalate, reach out. She's supposed to mentor her juniors. She's supposed to be mentored by her seniors.
Right.
She has to interact with doctors. Family members need reassurance. Somebody is breaking down. The young male adult's wife is crying. She has to be reassured. Here the patient is crashing. It's a very, very different environment.
Right.
People, those who are not in healthcare, cannot even imagine or understand. It is the nurse who opens the eyes of a newborn when a baby is born.
Right.
It is also the nurse who closes the eyes of a patient who just died.
Right.
It is the nurse who's part of doing the last rites of the patient at the hospital bed. Imagine the amount of mental grit, physical strength, resilience she needs to cope up with all of this. So in this entire journey, when nurses are very young in their profession, they get stressed out. They get burned out with the professional demands.
Right. Right.
They get distressed. Many of them just don't know how to cope up. Because when you are in a college, you are studying for 4 years. It is very difficult to think as a nurse when you become an independent professional how life would be. So nurses need a lot of support. They need a mentor when they become when they come new into the profession. So we assign a mentor to them for first 2 to 3 months. Apart from training them in the classroom, training them at the bedside with clinical mentors, we assign a mentor to them who is like a coach, like a sister or a brother to them, who actually they can reach out for their professional challenges, for advice, and also when they are in personal distress. Also, the senior nurses working in those areas should be able to pick up early signs of emotional distress.
Right.
So, which means all of us need to really be psychologists. We should have been well oriented to mental health challenges,
Right.
and hence so that you can actually encourage the nurses to be physically fit, to have their breakfast and come, to have breaks for their tea break, meal break, not to stay hungry, to have the right weight, to be able to take safety precautions so that they do not get into transmission based disease, and to have good mental endurance and mental health. Only then they can cope up with the challenging demands of a patient. A patient is already having lot of issues with his emotions. He's in anxiety, he's in grief, he's upset, he's worried, he has to pay the bill or he has to have a surgery the next day. So many challenges. A nurse has to be trained in all of this, and mental health is a very, very important aspect. And a few years back we all went through the COVID-19. So at that time we realized the additional need for mental health support for healthcare professionals, not just nurses, but all other professionals in the hospital, including doctors, because patients were left in the hospital and the family members were too scared to be around. Neither they were permitted. And for 2 weeks, 3 weeks, 4 weeks, families were not permitted to meet these patients when they were in quarantine or when they were in isolation. It was the nurses and the doctors who managed. That means they had to keep their health in order, their mental balance in order, and they were with PPE kits. They did not have food breaks. They were covered from top to bottom with N95 masks. It was sleepless night, worried about their own home, their parents, their children, but yet they stood at the patient bedside. I would say COVID-19 was a game changer for Indian nursing and for global nursing. That was one time in our country, the importance, the contribution of nursing profession was so much realized by the community, by the people, by even our Honorable Prime Minister and many other leaders. This was one time they were highly appreciated. They came to limelight. They felt so proud that they could save lives, and they were instrumental in saving hundreds and thousands of lives during COVID-19.
Right.
And also, we lost many nurses in this whole pandemic. But we are very, very proud that we stood with our core value of sacrificing, of taking care, of providing the right care to the people in need. And there was no better need than COVID-19, when your own near and dear ones were away and you were looked after by somebody. The nurse was feeding, the nurse was monitoring, the nurse was caring. So this is how the mental balance, resilience of nursing profession came into play.
Right. So, like you said, COVID-19 was such a hard time for the healthcare sector. So, I guess they faced many challenges. So, how can they make sure to have a work-life balance around?
This word does not go with the nursing profession. A nurse works typically on a day shift for about 8-9 hours. Then she has her commuting time, coming from her place of work or from hostel, going back. So de facto her entire day is spent. When she is on night duty, this stretches to about 13-14 hours. Nursing is also one profession you have no time to sit. You're standing, you're walking, you're running from one activity to another, from one patient to another.
Right.
You are sacrificing all your free time. This is one profession where you are there 365 days in a year in the hospital, whether it's Holi or Christmas or Diwali, whether it's a Sunday or it's a Republic Day. The hospital cannot be without nurses.
Right.
Because hospital is meant for patients. Hospital is not shut down to patients. Hence, nurses cannot take a holiday. They will be there. So, it is very difficult for them to keep up a work-life balance. And it is more tough for nurses who are married, who got families, small children. And it is very difficult when to give time back home. I remember my days. I have a daughter who's now grown up. In fact, I've got 2 grandsons now. So, you see, you feel so guilty as a mother. You are unable to give time to your children, whether it's their emotional need, whether they have to be taken out, whether you have to attend their PTM, whether you have to sit with them for their homework. You have no such time. There are times when a nurse leaves her kids sleeping on the bed, and when she goes back, they're still sleeping for the night.
Right.
She has not seen them awake during the day, and sometimes these times stretch to a week. So you can imagine work-life balance is really a very difficult statement for a nurse. But I would still say, having been in this profession since 77, I'll complete my 50 years in 2027, which is just 2 years away. You have to train yourself to create some time for yourself, some me time where you can contribute to a hobby, maybe reading, maybe watching movies, maybe going out for a walk, whatever. You'll have to figure out when and how much. You have to also be extra conscious of managing good physical health, great mental health. Train yourself, condition your body and your mind that you are in a tough profession, which has a lot of hardships, which has long hours. You have to stand for long hours. Hence, and design good health, mental and physical, so that you are able to continue in this profession year on year without yourself falling ill. Nurses also are exposed to a lot of high-risk diseases in the hospital. Infections, safety issues, ergonomics, they continue to stand, deep vein thrombosis, they have a lot of issues. They have to train, condition themselves, make efforts where they can design their activities so that they get short breaks. They take care of their food, they take care of their annual health checkup, their required investigations, and same time they are able to maintain good health. I long time back understood the value of good health, and I incorporated a morning walk or a evening walk based on my routine, and I continue to walk for 5 or 6 kilometers every day. Despite this winter, for me 5:30 a.m. to 6:30 a.m. is the walking time. That keeps my mental and physical health so much in order. So we have to make efforts to have a work-life balance. It's easier said than done, I would say.
Right.
In young age, very tough. When you're married, it is very tough. When you've got small children, very tough. But as you progress, you become better and better at managing work-life balance.
Right. I can't agree more. So, ma'am, like even after so much work, even after sacrificing their personal lives, but nurses don't get that much recognition and respect they deserve. They fair pay, है ना, right? So, how can we make sure कि they get recognition and the respect they deserve?
See, a little difficult question to answer, but I would say nursing is one of the noblest, and it's also a rising global profession. The entire world is struggling with shortages of nurses. It's a critical need in the hospitals. A great infrastructure, building, equipment, everything can be done, but getting well-trained, highly skilled, experienced nurses is the toughest thing, not just in our country, but in many countries across the world. As important and critical is this profession for any hospital. Hospitals can shut down if you do not have adequate numbers with right skills.
Right.
Imagine you start a operating theater. There are 10 theaters or 20 theaters. You don't have operating room nurses. How will the surgeries happen? You have got ICU with 100 beds. You don't have ICU trained nurses.
Right.
How will those ICUs where you need one nurse for one patient around the clock, how will they be looked after? It's a critical profession. It definitely has evolved in last few years, I would say. As I said, I've spent about 4.5 decades. I have seen the changing era of the nursing profession. I have seen nursing evolving even in our country to a great extent. Now you have nursing leaders in the boardroom part of the decision making. What is required for nurses? They are the decision makers along with other board members. So nursing empowerment in our country has begun. Yes, we still have to cross many milestones. Society is also changing their view about nursing.
Right.
As I said, COVID-19 was an eye-opener.
Right.
It was a game changer. So people have realized that nurses are important. They are not just blind followers of some orders. They are the people who are highly educated.
Right.
Nurses are they have undergrad degree, postgrad degree, PhDs, MPhils. They are into research, they are into training, they are into simulation, they are advisors, they are into higher positions, they are directors, senior director or vice presidents. They are into academics of teaching, they are into so many areas. So many verticals. Nurses are nurse practitioner, specialized nurses, operating room, ICUs, oncology, nursing. Nursing field is so vast.
Right.
They can stand shoulder to shoulder, and they do shoulder to shoulder in ensuring right treatment so that patients go home without any adverse incidents, with great clinical outcomes and with no complications.
Right.
And within that shorter length of stay. All this is attributed and contributed by the nursing, who are so competent, well qualified, with all specialized degrees. They are respected now. They are getting empowered now. Yes, we need to still scale up as a country in terms of their compensation, in terms of their maybe some places their living conditions. And government is already working on it in so many ways, whether it is state government or central government. Even the private sector has realized that they are critical resource for us. Without them, patient care is next to impossible,
Right.
unthinkable. Doctors have become highly supportive of nurses now. So times are changing. Times will change. If I can visualize 10 years from now, Indian nursing will also be on a very, very different pedestal.
Right.
And it's already changed in many countries. Even in India, we'll be behaving different and we will be at a different pedestal. I'm very, very sure, highly convinced, nursing is moving to the right place and it has taken all the right steps. It's on the right track. And in few years, I'll be a very happy person seeing the required recognition and the progress in nursing. It is moving. I would just give a unique punchline. In nursing, compassion meets innovation. In today's time, compassion is a critical attribute of a nurse without which you can't look after somebody who's ill.
Right.
It's also become so innovative. Digitalization. Nurses are using an app on their smartphone and they are entering patient data there. They are going to the patient room with computer on wheels. They do all entries on a computer. They have iPads which they hang and go to the patient's room. They work on robotic equipment. They work on laparoscopic, all high advanced things. So nursing from a compassion is combining it beautifully with innovation. That's how nursing is moving across the world and also in our country. Nursing digitalization is progressing by leaps and bounds.
Right. Ma'am, they are actually evolving, right? They are using, technologies to make it better patient care. Right?
Yes.
So that's it, ma'am. So very, very nice talking to you. And by the end of this podcast, I have very, huge respect for the nurses. Because thank you so much, ma'am. So it was nice talking to you.
Thank you so much. I'm really humbled that you thought of in the month of January 2025 to do a podcast for me. And it's really, that itself speaks of the respect and the recognition nursing is getting in our country. And thank you so much, InnoHEALTH, for reaching out to me.
Thank you so
you.
much, ma'am.